next panel, which Billy, you opened the way for. It's about healthcare cultural competency. There's a coalition that's growing around this topic, but basically there's a piece of legislation, House Bill 4654. And what this bill does is it requires that as part of license renewal, healthcare providers have to take so many continuing education hours. As part of that, they have to take cultural competency training. And so we have some great partners today who can talk about that and also what the sponsor of the bill. So I'm really pleased if they could turn their cameras on to introduce Representative Dagmara Avelar, our House sponsor, Alejandra Ibanez from Illinois Unidos, Mary Finador from the Equality Illinois Community Advisory Group, and Christopher Balthazar from Task Force and Community Services. I see them on.
For some reason, it's not allowing us to start our video. If the host could let us allow us to do that, that'll be great.
Great. I apologize for that. We'll get that taken care of. I know Ardina is going to work on that for everybody. But if it's okay, since our time is short, I want to just get started. And this is a question for everyone. Why is cultural competency as part of continuing medical education? Why is that important? And I'll start with Representative Avila.
Great. Thank you. Thank you for that, Mike. Why is there you go. You can see me now. Thank you so much. Representative Dagmara Avelar, 85th District, South Suburban District. And, going to the question of why is cultural competency important? In my previous life, pre-legislator, I was the director of programs at the Illinois Coalition for Immigrant and Refugee Rights. And we did a lot of work around citizenship, immigrant integration, and language access. And when we think about cultural competency, we saw it firsthand what the lack of cultural competency can do in our communities, right? So what with this particular bill, with HB 4654, what we're looking for is we want to make sure that licensed healthcare professionals take 5 hours of cultural competency training during their first license renewal cycle. And, this has to do with cultural humility, self-awareness, and, it's really, a tackle at making sure that we know and that we are aware of our own biases, right? So, this is a bill that attempts to do so. It is important to know, right, around that we come from very diverse cultures, and not just cultures, but groups as well as communities. So what does cultural competency mean? It actually means treating people with dignity and respect. So I think that that's at the core of this bill.
Thank you, Representative. And now Alejandra, Chris, and Mary, if you'd just like to say why cultural competency for medical providers is important for you and the communities you serve.
Absolutely. Thanks, Mike and team. I'm Alejandra Ibanez, the inaugural executive director of Illinois Unidos. We are a relatively new organization, statewide coalition created out of the crisis that is COVID. We were formed in April of 2020, nearly 2 years ago to the week almost that we went into shelter in place, and here we are, right? And so I think COVID really demonstrated to us or laid bare the kind of historic systemic barriers that the American health system has practiced, whether intentional or not, and the need for us to really come to terms with those systemic barriers that communities of color and other communities as the LGBTQIA community has been. And so for us at Illinois Unidos, cultural competency is at the core and our mission to ensure that the state's Latinx community has an equitable response, recovery, and resources available to them post-recovery. We were created because there just was not consistent, culturally competent, linguistically competent information about what COVID is, and that vaccinations were safe. I mean, it really allowed for the misinformation, right, about COVID. And so it really became a barrier for folks to really get the services and the understanding of why they had to get vaccinated. And it was their fault. It's just there hasn't been a consistent commitment to cultural competency in the information and services to a community that's been denied services, whether because of their immigration status, a perception of their immigration status, or for a number of other reasons. And so for us, cultural competency is a foundational commitment that the American health system has to practice. And this legislation speaks to that learning, that commitment that medical professionals need to provide. And I'll just share a little bit beyond, COVID. We ourselves have had to develop our own cultural competency information. While this is really the responsibility, really of the healthcare system. And so being able to educate and inform the medical practitioners to be able to understand the diversity and their patient-centered needs is critical. And so for us, we are happy to join, not even happy, we must join together and commit ourselves to this work because it's about racial justice, LGBTQ justice, and just equity for all our communities to have full access to public and mental health.
So much.
Absolutely. I'm Chris Balthazar. I'm the Executive Director at Task Force Prevention and Community Services. We provide health and social services to LGBTQ plus youth and adolescents and young adults of color primarily. In my work, as an executive director and, even previously working in medical, preventative, research, what I've noticed is that, is how the lack of cultural competence the role that plays in the increase of medical mistrust in underserved communities, right? All these communities that we often talk about, we need to be able to reach more effectively. There is medical mistrust, and a lot of that, is due to the lack of cultural competency. We see, even with a lot of our community members that we serve, them sharing complaints about providers who never even considered the fact that they were on hormone therapy and the impact that it can have with other medications that they might be having. Them feeling often like they are the afterthought because they're on this additional hormone therapy, right? Also, a lot of our community members complain about providers even making assumptions about their sexual, activities, right? Making heterosexual assumptions about, their sexual activities. And so I think when we talk about cultural competence, for providers, this should be the minimum expectation. And I think that providers, and don't get me wrong, there are lots of them out there that do it, but that are engaged in, doing kind of learning about the communities that they serve. But I do believe that, it is important, if we really want to, break down these barriers and we talk about getting to zero, we really have to get our providers on board and more aware of the communities that they are providing services to.
Thank you.
Is it my turn?
Yep, Mary, please.
Okay. Hi, everybody. Thank you so much for having me. Very cool to share a space with you all. So my name is Mary. I'm a member of the Community Advisory Council at Equality, Illinois, but I'm also a medical student. So I'm a first-year medical student. And I thought it was interesting when Mike asked me about this and told me about this bill, just because it's like, as everyone sort of said, it sounds like a really intuitive thing that should just exist. Like it shouldn't, it's like teaching a 5-year-old to say thank you. Like it really shouldn't be that hard. But that's kind of disregarding like the complexity of adult life and such. But I do think that one of the big problems is that the medical field, I think, and I'm generalizing, largely thinks that this is sort of like a soft skill. Like it's like a skill that shouldn't matter. Like it's like we're too busy learning about physiology and pathology and clinical whatever. We're bogged down in a lot of details. And it seems like because we're so focused on trying to do things very fast, like everything else sort of goes to the wayside, and cultural competency is one of those things. And I'm part of a class, thankfully, that's really, really good. We try to be really good about pushing the idea of cultural competency to our faculty and like to our administration. So we're always arguing with somebody about this. And to me, it seems kind of weird to not have this as part of medical education, and to not have it as a part of integrated, like continuing education for providers. It's sort of like saying that as like a medical student, just because I don't want to be a cardiologist, I don't need to learn about cardiology. That'd be ridiculous. Like you would look at me like, what are you saying? Why would you not need to know that? So this is an essential skill. And a lot of the mistrust that you all are talking about is very real, obviously. And the entire relationship between a provider and a patient is based on trust. And if you can't develop that trust, then you abolish all possibility of taking care of somebody, because they won't come back. And we can't make people come back. So the only way to do that is to try to understand a whole person, try to integrate everything that's about their life into their care, so that not only are you giving care that's medically good, you're doing it in a way where they can go out into the world and live their life. And that seems like a really intuitive thing. Also, because we have a professional obligation to do that. It's in my oath. I took an oath. When I swore into medical school, I took an oath. And I swore under pain of threat and death, I would protect my patients. I swore to die for my patients. That's in my oath. So why would I not be nice to them? Like, why would I not try to see where they're coming from or see where their barriers are? And it's not just about like politics and racial politics. It's about like genuinely trying to meet people where they're at, understand how you can help and how we serve them. That's it. It's really straightforward. But for some reason it gets kind of messy with folks, but really, like, you can't take care of people if you're not culturally competent. There's no way to do it. If it's a language barrier, if you don't understand anything about their community, and you can't know everything about everything, but the idea is that you'd be open-minded enough to try to learn, and you can at least open a dialogue. So if a patient comes to you, maybe they have to explain a little bit. That's not ideal, but again, we can't know everything. But we give them space enough that we're like, okay, I'm going to humble myself for 2 seconds so I can do my job and I can take care of you. And then that's it. I don't know if that actually answered your question. I had a whole spiel going off on that, but
I appreciate that. Thank you. And I'm glad that you are in medical school, because I love the perspective, and I think it's the perspective that we need. And that's why the legislation, it's not going to move this year. But we put a bill out there with Representative Avelar and Senator Villivalam, who will just texted, will be joining us a little later to say a few words. But it's why it's so important to have that piece of legislation out there. We're organizing around it for future years. Thank you all for your words. We're going to be, Moni and I will be following up with everybody in the next couple of weeks on how to keep moving the ball in this campaign, because there is opposition. There is opposition to requiring cultural competency as part of continuing medical education. And so we're going to have to push through that and work through it. But we want to make sure that we engage everyone. We're going to be working on story collection, because we want to hear these stories. We want to be able to share these stories, because part of legislating is demonstrating the need for something as well. And I see a note from Timothy. Y'all are great, because you're all leading me into the next topic. Mary Chris Alejandro, Representative Avelar, thank you so much for joining us today.